It's been a relatively quiet morning so far at County Air Ambulance Control in Cosford.
Thanks. Bye-bye.
But not for much longer. Dave Lavender and Simon Cusack are about to have their composure tested to the limit.
North, Hodley. 442.
They've been sent to a head-on smash between two cars. The female driver is trapped by her legs. The crew have been scrambled in the general direction. It's a 13-minute flight to the accident scene near Market Drayton.
F5, Helimed 03.
They get the exact coordinates over the radio.
Helimed 03, roger. Sierra Juliet 613.
285. So far, over?
Pilot Graham Cannell knows most of the accident spots by heart.
It's on the A442 at Hodnett. Received, right?
Whatever it is.
The RTA reported as 4 people trapped. They've got a landing crew not far away at Market Drayton who are going there having a look, but because of the what's been reported as the seriousness of injury, they're asking us to run as well.
Watch those wires. Yeah, I'll put you on the greeny bits. The copper is behind, but he looks as if he's got common sense. We can get through here, can't we? Yeah, you should be able to by the lorry. And you're all clear out. Thank you.
The driver, Kay Maddox, has multiple fractures to both legs and a broken left arm and hand. She is in severe pain.
All right, mate. How you doing? We got
bilaterals.
Yeah.
That's got on the one knee. Left arm, a lot of pain. Chest's clear.
Right.
She has no neck pain or back pain. She can remember everything.
Okay.
But legs trapped.
We'll take this one off you then. Okay.
Right.
You happy with that? Grand. Okay. Hello, my love. Right. Just keep your head nice and still.
All right. No, get me leg up. Oh,
all right, my love.
leg.
Right.
Sweetheart. Hold me leg.
Hello.
Please hold me leg. Don't sweet talk me. Just somebody hold me leg.
What's your first name, love? Can I get where you are, my love, please?
Kay.
Right.
What's your name?
Simon.
Simon, tell someone to hold me leg up now.
What we need to do is we
Right,
need to try and
cheers,
make a little bit of room to get into the car. Okay, we can't get to your leg at the moment.
I can't hold it anymore.
Sorry, is it above or below your knee, your right leg? Right, okay.
Yeah, hold it there. Just hold it with there so I can relax.
Just in here?
How's that?
What's your name?
Dave.
Thank you, Dave. You're with them.
Okay, well, I hope so.
You'll never have to do this again.
Were you knocked out at all, sweetheart?
For a bit.
Just for a little bit?
Yeah.
Okay. Can you open your eyes for me?
No, because I'm tired.
Because you're tired? I just need to have a look at your eyes if I can. How's your vision? When you open them then? It's okay.
Okay, so he's putting an oxygen mask on you, my love, all right? Okay, all right.
Just relax and breathe that oxygen in for us.
Let's try again. You're right with the head there, sorry?
Yeah, okay.
Okay, right.
What we're going to do, Kate, is me and my mate, we're going to look after you in the car, okay?
Can you just pull this from underneath?
The firemen, they're going to just...
You're right with the head?
Yeah, they're just going to cut a couple of the bits on your car so that we can get you out without hurting your leg at all. Okay, sweetheart? We'll tell you before anything happens, okay? Don't worry at all. You want to get to sleep?
As always, it's the fire and rescue units who are responsible for cutting the car away from the patient. With multiple fractures and severe pain, Kay will need the quickest route onto the stretcher.
No.
All right, then don't bother. It's your hair catching it. What's happened is her feet are actually trapped, her legs are trapped. We can't get at her at the moment to examine her properly. So what we were trying to do is get the door off and we wouldn't have to get to her. Simon's just holding her just to make sure that she's all right from that point of view. But she's playing a lot of neck pain at the moment, that's as much as we know, and she's also got pain in her legs. We're just going to try and find out exactly what she's going to be like when she comes out.
We need to have a good look at your leg first.
Because Kay's car has been so badly damaged, by the time she's freed, she will have been trapped by her broken legs for nearly an hour.
kind of a sheet here to protect you from the sharp edges. A sheet across here before you take the glass off.
Okay. Okay, you still hear me, my love?
Yeah.
You still don't look at your chest, alright?
Yeah.
You tell me if I hurt you. Just some bruising around the clavicle. I'm trying to get a camera if I can.
You gonna go for that arm or this one?
Either whatever you can go. If you can get on that side, fine. I might be able to get on this side, but
Was that the painful arm?
this is the painful arm. Is it your right arm that's giving you the trouble, or your left arm, my love? Your left. No, you've got the
your
painful
left
arm there,
arm.
so we go for this one this side.
Okay.
What I need to do, Kay, is cut your jacket. Is that all right?
Yeah.
Go in here then. So we need this glass clear in here.
Watch your eyes. Gents, can we have some protection between the patient, please? Thank you. Thank you.
You right there, Kay? Yeah? There's a sharp scratch in your elbow in a minute, just to know what I'm feeling, all right? Sharp scratch.
Oh.
All right, my love, I'm sorry about that.
Please stop the pain. Ow.
All right, Kay. You're doing really, really well, my love.
Yeah, they appear okay.
You've got a... You
Give
take
me
a head.
some gas.
You got a head.
Yeah.
Give me some
Okay.
gas, I hurt.
All right, my love.
Give me that thing I had before.
Dave?
Hurt me, please.
Sorry?
Dave?
Basically,
Entonox
she's
down
got... she hasn't had an Entonox. I don't particularly want to give her any, to be honest, at the minute. It's just... The
Yeah,
chest's a bit...
don't they?
We're not sure about the chest, to be honest. And the rests are going a bit dodgy, so...
This pain relief,
Now.
it's here now.
Here, get it in your mouth.
All right, my love, you feel a bit of cold going up your arm?
Quick. Give me that thing.
Can you feel that cold in your arm, Kay?
No. Give me that other thing to breathe on.
We can't give you that at the moment, sweetheart.
Just
Because we're concerned that you may have a problem with your chest.
Sometimes be a bit careful.
Oh, it hurts.
All right, my love. She's got a gash just on the
Yeah.
inside of her.
Pulling on my arm.
Right, yeah, the ball's ready to go. All we need is just to get her out now.
Yeah.
You happy with her there, sorry?
Yeah.
Okay.
This is very intimate.
Yeah.
I don't even know your name.
You'll say.
Right, if we can try and rest her back onto the board now.
Ow.
Okay, you want to bring that in?
Just gently. All
Ow.
right, Kay,
Ow, my back hurts.
your back. All right, my love, just nice and steady. Just relax. Relax. Relax.
Ow.
Well done. Okay, I've got the head. Really need to get her out.
Oh, my leg, my other leg, hold it, please, I'm going to be sick.
Do you want to rest for a second?
The other leg.
Push that out and make the job so
I'm
much
going
easier.
gently.
We're ready.
Sorry, we've got to get her out one more time.
Yeah.
Just do it, yeah. Do it,
Okay.
please.
2 minutes.
So we take the steering wheel off as well?
Yeah.
Yeah, do
The
like
next stage is going to be the most anxious. The injection doesn't seem to be having much effect, but it's the most they can give. Kay must get to hospital as soon as possible.
that. Is it Stoke? Oh,
They
sorry,
have to
Stoke.
free her from the car
Right, let's
immediately.
go. On 3. 1, 2, and 3.
Well done, well done, well done.
Oh, my leg. Oh, my leg, it hurts.
Can we have the straps?
Well done, Kay. You've done really, really well there, my love.
Excuse me,
Yes, my love.
why can't you give me something for the pain?
That's what the drip's for, my love. All right.
It's not doing the thing.
You won't feel anything. You won't feel anything going
it's
through.
hurting me.
All right, just nice and steady.
Oh,
If you take a head off me, leave the blocks for a minute.
you're
Take a head off
hurting
me.
my
Take.
leg. I don't want anybody listen to me. Oh, you're hurting me leg. You're hurting me leg.
Are you ready? On
Okay.
1, 2, and 3.
Actually, I can't understand why you're hurting me leg.
Then-
Ow! Ow!
Let's get her wrapped.
Because Kay is in such pain, the paramedics have called for a doctor to come and administer a stronger painkiller. He arrives as she's ready to be loaded.
Doctor's arrived now, sweetheart. He's going to give you something for the pain.
Will you please get me leg? My
2, 3.
leg. Give me my
If we can get Doc over to the what's it and have a look at her there, and I think it's more the fact she's so tight. It's,
Okay, right the way up.
Did a bit.
On the left-hand runner.
Okay.
What about this thing I got?
The crew alerts the trauma team at North Staffordshire Hospital.
Right, so it's a 30-year-old. They said a GCS of 15, but she's confused. Chest seems to be fine. She's got a fractured left humerus, queen fractured pelvis, queen fractured femur, associated with multiple limb fractures as well. Pulse rate 44, sorry, pulse rate 106, chest 44. And that's as much as I can give. ETA will be 10 minutes on a red.
Yeah, we spoke to Ivan.
No, we'll give them a brief now. Are you? Trauma team to recess, please. Trauma team to recess, thank you.
Consultant Ivan Fair has been called in as trauma team leader. The flight from the crash site has been only 9 minutes. Because of Kay's injuries and the pain she's suffering, the crew will do a hot unload.
We'll bring her out in a second, okay? We'll bring her out hot. All right.
She's also got a large laceration to her left leg, just for information. Was reluctant to give a new vein because of the chest. Doctor on scene gave her 10 milligrams of Coronamorph? Cyclomorph, sorry, yes. IM into the right arm. That was just as we were leaving, so whether it's taking effect yet, I don't know. She doesn't seem to have.
How much IV fluid has she had?
She's only had what's left out of the bag. She's had radial pulses throughout. I didn't want to overload her too much, so we just kept the radial pulse. Cyclomorph was given at 11:55.
It's only when Kay's clothes are cut away that some of the injuries become apparent.
Okay.
Stop it! Please stop the pain!
What's the blood pressure?
Please! Please! It hurts! Please!
15 minutes, all right.
No, the doctor's still with her. She's almost certainly got a fractured ankle, right ankle, fractured thigh bone, also fractured upper arm as well. Apart from that, it's injury we can find at the moment, but there may be others that we haven't found as yet.
Kay needs a series of x-rays and scans to catalogue her list of broken bones. Her airbag and seatbelt almost certainly saved her life.
X-rays. Paul, mind your bits.
Hey, real feels okay.
No, we want to do that.
Well, we put an anterior stirrup on where we wrap a bit of wool around this, get a big slab of say 6 inch. We cut it about here and put that as a stirrup around the front of her leg. Okay? Do one of those. X-ray builders. Yeah, she's got something's happened there.
Well, it was obvious that she was in great pain due to multiple leg fractures. We were slightly concerned about a head injury, chest injury, and abdominal injury, but within our initial assessment, we were able to exclude that.
No, I'm so much to move.
Does that hurt there?
The resuscitation then concentrated on splinting the fractures, making her comfortable, trying to relieve pain. And then the X-rays have now subsequently shown a lot of major fractures in both legs and left humerus, which will be dealt with by orthopedic surgeons over the next number of hours.
Once the initial assessments are done, Kay's parents are allowed to make a fleeting visit.
There's nothing serious that is going to be put right. I told Emily, yeah. And then what about the shirt? I told that lady off the session there. So I won't do that.
All right.
Let's
go then.
Kay had to have an 11-hour operation to reset her broken bones and insert a grid of pins to rebuild the worst fractures. She spent nearly 3 months in hospital.
So these are Kay's X-rays. Here you can see her fracture of a right femur. This is a transverse fracture, but there's a spiral element going right up the shaft. And in fact, as you see on a further film, it actually communicates up there, and a Thomas splint holding it in position temporarily. Here, the injury to a lower leg, this is her ankle. This is the one that was dislocated, and tibia and fibula on the right leg. This is her left arm, her humerus, angulated mid-shaft fracture, and the nerve, the radial nerve, spirals round here, so it can be vulnerable from that spike of bone. And then further down the left arm, she's got a fracture through her wrist there, and a couple of fractures in her hand. She's doing all right, but because of the nature of the injuries, she can't weight bear early. So as much as possible, we'd like to have people up and mobilising, but in this particular case, she's having to do a lot of bed rest, and that's tedious for her, but that's the way it has to be at the moment.
Something that you wouldn't expect, really. You see things on television and you just don't believe that all these things are going on. And she was shouting, and I was just glad that she was alive, and that the air ambulance had got her here so quick, and I was glad that we got that service. I knew she was in safe hands, and the team of surgeons that worked on Kay were magnificent, the work that they did. And peace to, well, we've got a bionic woman, haven't we now?
Kay had double vision and bruised lungs to add to her tally of over 14 separate fractures to both arms and legs. She had to stay in bed for the first 8 weeks in hospital. Her recovery, though steady, is very slow. For Mick Ryan, whose head was crushed in a building site accident, the news is more encouraging.
When he came in, he had an extensive skull fracture. There was bone fractures at the back of the eye which were impinging on the optic nerve and the nerves surrounding that, such that from the time of the accident to when he arrived in hospital, he was developing blindness in that eye. So we went in and essentially decompressed his right eye socket. Then the fractures around the face have been reconstructed with the plate that you've seen on the X-ray.
He was kept in for 8 days after his operation. In the 11 weeks since, he's made good progress. It's time for his final checkup.
So you've got the scar over the eyebrow from the injury, which is settling, and then there's the scar across the top of your head, which is hardly noticeable. That's good. What I'm going to do, I'm just going to lift your right eye a little bit. He's done remarkably well after a life-threatening injury, and it's a case of just waiting and seeing how he recovers himself. Yeah, it's going up as well, isn't it? And come down.
I'm feeling quite well, actually. When I see what I've come out of, I feel terrific. They say I'm not fit for work, I'm not fit for this, I'm not, but I feel fantastic, really, from where I could have been.
Had we not operated when we did, then there would have been no possibility of any recovery in that eye. And the fact that you can bring patients in the shortest possible time to a centre where you've got resuscitation facilities for acutely injured patients is critical if you're going to optimise their long-term outcome.
I want to thank everybody involved in helping me. Special thanks to the doctors, paramedics, ambulance crew, hospital nurses, helicopter crew, and everybody that was involved saved me. Because at least I'm up and around and I can see, I have to see anyway, and I can walk around. They've done a very good job. Fantastic. Thanks.
Oz and Dee are also grateful for the help they received when a Christmas shopping trip was cut short by a head-on crash. It's been 4 months and they want to revisit the spot where it happened.
Yes, this has got to be it. Yes, this is it. And this is where you ended up at, roughly about here. About here. This is where your car ended up, roughly about here. Yeah. He was literally in front of us, and you just know you're going to have that impact, and it's just seconds. I said, oh my God, and I said, what's going on? And that was it. My first thought was, thank God we're both alive. Just thank God that we've got out of this alive, because when you're going to have an head-on crash, you just think you're going to lose your life.
Although people give me reminders or told me bits of what's happened before, I cannot remember anything. Nothing will come back, no memories, but obviously all the evidence and proof is here, I guess, isn't it, again, with is a fragment off the car itself. I can't identify which part, I do not know, and again, there's something else here. Again, I'm not sure exactly were they parts of the bumper or I don't know what could be a hold of the light even do, I'm not sure exactly.
Yeah.
There are a few fragments, I'm afraid, aren't there?
Do you want them as souvenirs or not?
No, I do not want them. I definitely do not want them. No, I don't want any souvenirs. I definitely don't.
That's where they landed.
So
Landed
we were
and
quite
picked us
lucky
up.
they got
Yeah.
us there, then the hospital's pretty near.
That's right, yeah. It feels strange. I recognise the bends straight away. It's the right-hand bends that are imprinted on my mind now. And when I'm driving, I'm just always nervous of cars coming around a right-hand bend fast. Just think it's going to happen again. I'm terrified now. The very fact I'm standing here and there's cars coming round that bend, I keep thinking, are they going to go out of control and come straight across at us? I mean, we're risking our life here, just standing here. You know, that's the impact it's left with me.
The doctor said it could be as long as the academic year, the next September before I start back. I'm hoping that can be soon because I really like to be a little bit normal for once in a way. I really, really would.
It makes you realise you're not in control of your life. Anything can happen at any stage. It does sort of shake you up a bit.
It's 8 months since the accident. Dee still needs physiotherapy, and Oz is not yet back at work.
They got a mobile phone and they're going to ring the call.
But for the pilots and paramedics of the County Air Ambulance, the work doesn't stop.
Sierra Kilo, 527.
In any one year, they'll fly on more than 1,700 missions.